Good morning, friends. So hope you have revised this content, and now we are going to start different types, yes, different symptoms, yes, of schizophrenia, and there are so many change, so many updates. Okay, yes. So it is started now. So we started schizophrenia. In schizophrenia, I told you that Snyderian first rank symptom. This is DSM-5 said that these symptoms may be found in other psychiatric disorders, so we will not use them as diagnostic criteria. Good morning, all. Okay, diagnostic criteria. But ICD-10 is still using. So there is difference between ICD-10 and DSM-5. So when question is asked, long clinical question you will find, you will remember that if they are giving only one symptom out of these 11 and they are asking diagnosis, means they are following ICD-10. Okay, in ICD-11 they have removed these criteria. Yes, what are the criterias I will discuss, don't worry. In ICD-10, yes, ICD-10 they have given one more thing, that they have divided schizophrenia in subtypes. Okay, psychiatry has become little bit difficult because there are three classificatory systems which are being used. One is DSM-5, second ICD-10. Now ICD-11 has come but not implemented till now. So students get confused. First thing you will remember, that ICD-11 you will consider ICD-11 if they mention. Okay, so if they mention, till now it is not implemented, draft has been released, it is supposed to be implemented from 1st January 2022. So you will be thinking that in our NEET exam next year, yes, what would be the status? Yes, whatever status may be, I will inform you, don't worry. Okay, so for the time being, yes, you will remember ICD 10 and DSM 5 and the changes in ICD 11. So ICD 11 has removed subtype. Yes, this is a favorite question of many exams, that schizophrenia may be of paranoid schizophrenia, catatonic schizophrenia, hebephrenic schizophrenia, simple schizophrenia, and there are so many clinical questions on this. So this classification has been removed from ICD-11 and DSM-5, but ICD-10 still has this classification and questions are asked. So you can't ignore this classification. So to try to simplify, to integrate, yes, I have made this diagram, or you can say handout, in such a way that you will remember conceptually and mnemonically also. So yes, I told you that schizophrenia may be of four type, yes, commonly on which questions are asked, otherwise residual is also there, different types. So for the time being, yes, in your handouts you will write like this. Here below these diagram you will write, yes, below these diagram you will write catatonic schizophrenia, catatonic schizophrenia. Yes, you will appreciate later that this diagram, this page would be sufficient to solve most of the question. Okay, so don't worry. Yes, it is, yes, you, it seems very small, but all question will be solved by this page only. Catatonic schizophrenia, then paranoid schizophrenia, then hebephrenic schizophrenia, right here, hebephrenic schizophrenia. Then here you will write simple schizophrenia. Okay, so what is the purpose to write that? Yes, all the symptoms of catatonic schizophrenia, yes, are these are symptoms of paranoid schizophrenia, these are symptoms of hebephrenic, these are symptoms for simple schizophrenia. Okay, so we will discuss these symptoms one by one. Before that, we have idea there are four types of schizophrenia according to ICD-10. Yes, you will remember, according to ICD-10. Okay, these types of schizophrenia. Now, okay, audio must be better now, I think. Yes, please do reply. Yes, is there any problem in the audio? Yes. Now, yes, first is catatonic schizophrenia or catatonic symptoms. Catatonic symptom means motor symptoms. Catatonic symptom means motor symptoms. Okay, motor symptoms. Let me tell you again that these are Snyderian first rank symptom. They are 11 in number. Out of these, even single symptom is there. Yes, now then you will make the diagnosis of schizophrenia. Clear? According to ICD-10, importance in DSM-5 has been removed. Now, motor symptoms, it is a favorite topic of question, PG entrance exam. Yes, what are the motor symptoms? First is excitement. First is excitement. What is excitement? Patient is having increased psychomotor activity. Increased psychomotor activity. You will say that, sir, increased psychomotor activity was present in mania also. Yes, in mania, you will find that psychomotor activity is increased, that is goal directed. That is goal directed. In mania, goal directed. While in catatonic patient, psychomotor activity is increased but non goal directed. Non goal directed. What does it mean? In mania patient, you will find, we will discuss that he will start a work, means he will wake up early in the morning, he will start washing clothes, means he has increased activity, that is goal directed, means is doing some work but he will not complete the work. Okay, means manic patient wake up early in the morning and after waking up start washing clothes but leave it between, means distractibility. It is called distractibility. I am discussing catatonia, so no need to be confused. I am telling mania at the same time just to differentiate that psychomotor activity is increased both in mania and catatonia, but in mania this is goal directed. In catatonia, excitement, it is non goal directed, means the patient is aggressive, disrupting the OPD. Yes, and he is injuring, or he may be very destructive, he is very excited, he is very aggressive, means many time you will find that the catatonic patient who is in excitement is not able to, you are not able to control this patient. Means if you have seen this patient once, you will never forget. He is so aggressive, so violent, so destructive, so non goal directed activity. Okay, so in catatonia you will find the few patients are having excitement. What I said, few patients are having excitement, but few patients Most of the patients are in stupor. What I said? Patient may be in excitement, increased psychomotor activity, or patient may be in stupor. Means few patients of catatonia are excited. That is called excitatory catatonia. Don't write. Few patients are stuporous. Stuporous means decreased psychomotor activity. 1 point. Second point, mutism. Mute. The stuporous patient is mute, not speaking at all, no movement at all. Okay. Hyporesponsive. Hyporesponsive to internal and external stimulus. What does it mean? Internal and external stimulus. What does it mean? Internal stimulus means if he is feeling thirsty, he will not move to take water. Means he is hyper-responsive to internal stimulus. External stimulus means you are commanding him, you are saying something, he would not respond. So stupor question is asked, what is stupor? Yes, what is stupor? Stupor means decreased psychomotor activity, means no movement, he is standing. Mute, he is not speaking. Hyper-responsive, you ask some question, you ask to do something, yes, go that place, lie down, stand up, he would not follow your command, means he is not responding to the stimulus. That is stupor. Yet hyper-responsive to both internal and external stimulus. Clear? So question has been asked on individually stupor. Stupor is a symptom which is present in catatonic disorder, okay, and other disorders also. But you will remember, yes, if catatonic patient is having stupor, stuporous catatonia. If catatonic patient is having excitement, excitatory catatonia. And stuporous catatonia is more than excitatory catatonia. Yes, stuporous is more than excitatory. Okay, so there are few questions, in fact there are many classifications for that, and few questions are like this. Now, echolalia, a catatonic patient. Yes, I am telling you the motor symptom or catatonic symptom. Echolalia. Yes, echo means echo, you know. Lalia means language. Lalia means language. You must have played copycat. Yes. Yes, you ask the patient what is your name, patient would say what is your name. Where do you live, patient would say where do you live. So whatever you are asking the patient, patient will reply the same thing. This is echo of language, echolalia. Echopraxia, whatever you are doing, the patient will echo the same thing. Praxia means motor movement. Motor movement. Yes, you know, I am very angry, young angry man. One day I was visiting a ward. What I said? I was visiting a ward. There was a catatonic patient. There was a patient of schizophrenia. Yes, I am talking about catatonia, one type of symptom of schizophrenia. One types of symptom is catatonic symptom. The patient was sitting, and when I entered the ward, I did like this and this. Patient, yes, did echo, means mimicking the motor movement. Patient did the same thing, this and this. I was so angry, I said put him on ECT. Put him on ECT. Put on ECT, इलेक्ट्रोकन्वल्सिव थेरेपी. मैंने करंट लगा दिया उसको. आई एम सो बैड पर्सन. No, 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 like that. Yes, means I examined the patient. I found few symptoms of catatonia, and one symptom is echopraxia, echo of motor movement. And if echo of motor movement, three symptoms are there: echolalia is there, echopraxia is there, stupor is there, you will make the diagnosis of catatonia. I will discuss, don't worry. And the best treatment for catatonia is ECT. Okay, so just to, yeah, the purpose to tell you story is that in exam this story will help you to remind, yes, what was the exact answer. Okay, so for the time being, yes, best treatment for catatonia. If question is asked, what is the treatment of choice of catatonia, so without second thought, the best treatment is electroconvulsive therapy. Okay, and Mental Health Care Act, just make a box, a small box, and write down, yes, Mental Health Care Act 2017. Mental Health Care Act 2017. Direct ECT. Direct ECT. What is direct ECT? Yes, you must have seen many movies in which that you put two electricity wire and keep at this, and there is straightening of hair. Yes, in our movies, ECT is depicted like that. No, that is not ECT. Definitely, you can compare it with direct ECT. In direct ECT, we don't give general anesthesia. We don't give muscle relaxant. Yes, just to prime, when we will do ECT, then it would be easier for you to understand. In ECT, what we do nowadays, we use indirect ECT. Yes, what is the difference between direct and indirect? Direct means you will directly apply electric field without general anesthesia, without muscle relaxant. When you apply current, convulsions would be there, and muscle contraction would be so strong that there may be fracture of bone, vertebra. So it was found that direct ECT produce fracture, very serious side effect. So we said, why to give direct ECT? We will give general anesthesia, we will give muscle relaxant. After that, we will give electric current, that is called indirect ECT. But Mental Health Care Act said that now you can't apply direct ECT to anybody, because our old professors were very fond of direct ECT. They were very fond of direct ECT. Why direct ECT? Because direct ECT is having little bit better result. They used to think like that. Okay, so but indirect ECT is equally effective according to Mental Health Care Act. Yes, 2017. I will discuss Mental Health Care Act in detail because this is a hot topic now. According to Mental Health Care Act 2017, direct ECT is totally banned. Totally banned. Yes, just to give you important point, because question are asked. Yes, it will help you to remind that when I was talking about catatonia, at that time I discussed, I give extra time to ECT, so you will remember best treatment of catatonia is ECT. And to make the diagnosis of catatonia, there are few criteria, few symptoms are there on the basis of which we can make the diagnosis of catatonia. One of them is excitement. In excitement, increased psychomotor activity, stupor, echolalia, echopraxia. Now, if a question is asked and they have given this diagram, yes, this diagram is given, this diagram is given, or this diagram is given, answer, there are possibility of three answers. There are possibility of three answer, means a single word may change and the answer may change. Let me describe how questions are asked. Don't get confused with different guides, okay, at different places. I am taking it from fish psychopathology standard test book. Okay, so what is fish? Yes, psychopathology. Okay, so I don't discuss that, but yes, what is posturing? We start with posturing. Suppose a schizophrenic patient is in ward. You go to ward. What I said? You go to ward and you found that the patient of schizophrenia or catatonia is standing in this posture spontaneously, in this posture spontaneously. So I write here spontaneous. Means they will give this picture and they will say that when you are taking out of ward, you found the patient of schizophrenia is standing in this abnormal posture for long hours. He is maintaining this posture for 2.5 hours spontaneously. You are not doing anything, but you saw. Means this is spontaneous maintenance of abnormal posture, and they will ask what is this phenomena. You will say this is posturing. This is posturing. But if they say that there is a patient of schizophrenia or catatonia lie down, is lying on the bed, you are doing examination. You are doing examination. Now I write like this. Suppose a patient is lying on the bed. Suppose I take this picture. Patient is lying on the bed comfortably. You are doing examination. Passive movement. Passive movement. Yes, if I ask patient to move hand and patient do like this or any movement, we will say it is active movement. But if you hold the hand and move the hand, then we say it is passive movement. Passive movement. And in passive movement you may feel resistance or no resistance. If in passive movement no resistance, then you will say that no resistance or resistance. Means in passive movement resistance may be present or absent. If resistance is not present and you are moving movement and you left the this hand in abnormal posture, and patient maintained this abnormal posture for long time, so no resistance and final posture maintained, then you will say this phenomena is catalepsy. Catalepsy. Okay. But if resistance is there and final posture is maintained, final posture is maintained, then waxy flexibility. Please do reply. Did you understand this point? Yes. The same picture they will give. This picture is given in the question picture MCQ, and they ask this patient maintained this picture spontaneously. The answer would be posturing. They said that this patient was lying down comfortably. You were examining the patient. During examination, passive movement, you felt no resistance and patient maintained the final posture. No resistance, patient maintained the final posture, and this is catalepsy. Patient maintained the final posture, but resistance was felt. Yes, that is waxy flexibility. Sometime you will find that the patient has resistance, just like you are bending wax candle. Yes, okay. So sometime in question you will, yes, again I repeat. Okay, again I repeat. This is very important because confusing again and again questions are being asked, and in questions you will find incomplete statement, and that's why you get confused. Again repeat. You find a, okay, let me give with example. That's why I have taken question. A 55-year-old man with chronic schizophrenia, no resistance on passive limb movement, obtained during neurological examination, and maintain abnormal posture for long time. Which of the following symptom is he exhibiting? Yes, please do reply, then I will explain it again, don't worry. Whatever you think, please do reply. A 55-year-old man was with chronic schizophrenia, no resistance and passive movement. Yes, good. During neurological examination. Yes, good. That is, that is good. So you are giving correct answer. Definitely the answer would be catalepsy. Okay, good. But in the same question, if I remove this no, yes, if I remove this no, yes, I take different color. If I remove this no, a 50-year-old man with chronic schizophrenia resistance feels resistance by on passively movement attempting during neurological examination, maintain abnormal posture for long time. Which of the following symptom he is exhibiting? Symptom or sign? You may write sign. Yes. So answer would become waxy flexibility. Okay, waxy flexibility. Okay, now you got the point. Now same question. Yes, a good. Now same question. If I remove a 55-year-old man with chronic schizophrenia, maintain abnormal posture for long time, which of the following symptom? Now please reply what is the answer. What is the answer? Yes, yes. Now the answer would become A. Clear? Good. So yes, I will try to give all the question. Further discussion would be in such a way that further discussion would be in such a way that a single word change and the answer would be changed. So this would be the beauty of psychiatry. Not only psychiatry, in questions you will find that a single word can change the answer. Okay, so I think now it is clear. Let me revise it fast. If patient maintain the posture spontaneously, posturing for long time. If you are doing passive movement and you feel resistance, just like bending wax candle, waxy flexibility, and final posture is maintained. If you don't feel any resistance, then it is catalepsy. But when questions are asked, they give cataplexy also. Cataplexy, and we get confused between catalepsy and cataplexy. Cataplexy is seen in narcolepsy. Seen in narcolepsy, daydreaming. In narcolepsy, there is sudden loss of muscle tone, sudden loss of muscle tone. There would be sudden loss of muscle tone. Means patient is standing, there is sudden loss of muscle tone of anti-gravity muscle, and patient will fall down. Sudden loss of muscle tone of anti-gravity muscle, then patient will fall. Or sudden loss of muscle tone of jaw drop. So jaw drop, falling. Now I ask you that if this sudden loss of muscle tone, if you forget about sudden loss of muscle tone, if a person fell down suddenly, you will think of, you will think of, you may think of, you may think of transient ischemic attack. Yes, this when this question is asked on cataplexy, sometimes we are confused with medicine question. But how to differentiate it from medicine question? That is, in cataplexy, conscious level, consciousness is not lost. Means patient is conscious. से लिख लो, patient is conscious. Means when he fell down, yes, at that time consciousness was present. Okay, so in transient ischemic attack, patient would be unconscious. In seizures, patient would be unconscious. So many times when they ask question on cataplexy, what I said, they ask question on cataplexy. So they always mention this. They always mention this patient was conscious. So it will help you to solve long clinical question. And how to remember? Yes, one important point I would like to mention, that narcolepsy, lepsy is not present in lepsy. So sometimes what we do, narcolepsy, catalepsy. So catalepsy should be in narcolepsy. No, lepsy is not present in lepsy. In lepsy there is plexy. In lepsy there is plexy. Clear? So these are common clinical question on which yes, many questions are there. Yes, this topic in market, and little bit confusion is there. Now other symptoms of catatonia are autonomic, yes, automatic obedience. Automatic obedience. What is automatic obedience? If you ask a person to protrude his tongue, a catatonic patient is there in ward, you ask the patient to protrude his tongue, he will protrude his tongue. You will take a pin, prick, he will take his tongue back. Yes, everybody would take the tongue back. But what is different in this catatonic patient? You ask this patient again to protrude his tongue, he will protrude again. You will prick again, he will take it back. Again ask, he will do that. Means he will repeat the motor movement despite painful consequences. Okay, following the command, following the command, the command despite painful consequences. following the command despite painful consequences. That is automatic obedience. Definitely you will not do that. Once I will prick you, second time you will not protrude your tongue. But a catatonic patient would protrude his tongue again and again. That is called automatic obedience, following the command despite painful consequence. Second thing is grimacing. Grimacing. A catatonic patient will acquire a abnormal facial expression. Yes, sometimes the catatonic patient is sitting like this. Means maintaining abnormal facial expression for long time. Maintaining abnormal facial expression. Yes. What about stereotype and mannerism? If you don't have space like this, you write like this. Stereotypic movement. If you remember, I told you a child of autism is doing like this. These are stereotypic movement. These are repetitive, spontaneous. Yes, these are repetitive. You are not saying the child to do that. In the same way, catatonic patient is supposed doing like this. Cataton, yes, is repetitive, stereotypic. You will say what a odd movement are. Odd movement are odd. अजीब से हैं. Non purposeful. Non purposeful. Clear? What about mannerism? Mannerism is again repetitive. Let me give you example of mannerism. A catatonic patient is standing and salutes every passerby. Whoever goes to that place, he salutes. Means you will say these are repetitive, spontaneous, odd. Definitely you will say what is it's an odd movement. Means to salute every passerby, you will say these are odd movement. Semi-purposeful. What I said? Semi-purposeful. Yes, in few books it is written purposeful. In few books it is written purposeful. In few books it is written semi-purposeful. Yes, semi. Why I say semi-purposeful? Because it is not any purpose. Yes, to give regard to each and everyone, but he is giving regard to each and everyone. At least some purpose is there. He want to give regard. Okay, so semi purposeful. Clear? So repetitive, this portion is same, this portion is same, this portion is same. Yes, only difference is non-purpose and semi-purposeful. So these are common symptoms of catatonia. Yes, one more on which question is asked: negativism. What is negativism? Yes, I know that this is little bit boring. But these questions are asked, and if you will remember the gesture I have shown you, yes, it will help you. Yes, negativism is just opposite to automatic obedience. In automatic obedience, he was excessive obedient. In negativism, yes, non-purposefully avoiding the command. Means he will not follow the command, or he will avoid the command, but he would have not any purpose. Yes, you will say something to do that person, he will not do that work, but he has not, means he is not doing it deliberately. Okay, non-purposefully avoiding the command. Okay, if you don't remember, again I repeat, If you don't remember what is grimacing, it's okay, but you will remember grimacing is a feature of catatonia. Automatic obedience, name is sufficient. Stereotypy, mannerism, negativism, these points should be echolalia, echopraxia. These words should be very clear to you that these are present in catatonia. And out of these, if three are there, how many? Three or more than three are present, then it is catatonia. What I said? Previously I said catatonic schizophrenia. Now I am saying if three or more than three are present, then it is catatonia. I am not saying catatonic schizophrenia because ICD-11 and DSM-5 they have made a separate diagnosis, catatonia as a separate diagnostic entity. According to ICD-11 and DSM-5, catatonia is separate separate diagnostic entity. Means just like schizophrenia, just like depression, just like anxiety, yes, catatonia is a separate diagnosis. Catatonia means out of these symptoms, if three symptoms are there, you will make the diagnosis of catatonia. Means any patient, it may be suffering of any disorder. What I said? A patient may be suffering from any disorder, but if in that patient you find three out of these symptoms, you will say the patient is diagnosed with catatonia. So catatonia may be present in mood disorder, may be present in schizophrenia, option A, option B. Catatonia is most commonly present in catatonia is most common in. What is the answer? Option A or option B? Okay. Meanwhile, you give answer of this question. Yes, let me tell you, repeat mannerism. What is mannerism? Means suppose a person of catatonia is standing, yes, and doing salute. Means this is spontaneous, repetitive, odd. You will say these are odd. And semi-purposeful. Why it is semi-purposeful? Means yes, there is no need to salute each and everyone. There is no purpose of saluting to each and everyone, so this is not truly purposeful, but he want to give some regard, so we use the word semi purposeful. Okay, let me give you Shikhar Dhawan. You have seen Shikhar Dhawan doing like this. This is repetitive, spontaneous, repetitive, spontaneous, odd, semi purposeful. Means what is the purpose? Yes, some shape of stacks are maintained. Okay. Yes, this question, when this question was asked, most of the student marked answer as B, but answer is A. Yes, we found that catatonia is a entity, is a diagnosis which can be present in any psychiatric disorder, and we know that there is a separate type of schizophrenia, catatonic schizophrenia. So we thought the most common cause of catatonia should be schizophrenia, but no, it was found that catatonia is most commonly associated with Mood disorders, depression. Yes, Ujjwal. Good. So, depression. Clear? So, this is catatonic schizophrenia. Got the point? Sorry, not catatonic schizophrenia, catatonia. So, I think you understood that thing. Okay. Now, I would like to mention one more thing. Yes, that treatment of catatonia. Yes, here only I will discuss. Okay, one more thing. Yes, medical condition, just like hepatic encephalopathy. Medical condition hepatic encephalopathy may present with catatonia. So any disorder, it may be psychiatric, it may be medical, may present with uh, rigid mannerism, stereotype, automatic obedience, posturing, echolalia, echopraxia. If any psychiatric disorder or medical disorder present with these symptoms, we will make the diagnosis of catatonia. Ki the patient is in catatonia, and we will treat the patient as catatonia. And what would be the treatment of catatonia? Treatment would be, yes, initial treatment. Initial treatment, yes, IM lorazepam. Yes, you will give intramuscular lorazepam, and the patient will recover many times with intramuscular lorazepam. So that's why question is asked initial word, and they will ask question treatment of choice of catatonia. Then you will say electroconvulsive therapy. So both are question. So they are very clever. They ask question. Yes, Aman, negativism is also a part of catatonic symptom. Is also catatonic symptom. Yes, I have restricted my discussion. There are much more symptoms. Gegenhalten, in fact, Mitgahan, Mitmagen. There are so many symptoms of catatonia, but I am taking only those one which are frequently asked, and clinically found. Okay, so negativism is also symptom of catatonia. Now, initial treatment lorazepam, treatment of choice ECT. They are very clever, as I told you just now. They ask question. There is a patient of catatonia, and came to you. He is very aggressive. He is destroying the property of hospital. He is trying to kill, hurt family member, try to hurt health professionals, try to harm himself. Then what is the next management? Not initial, what is the next management? So next management means initial management. Okay, so most of time you will think of lorazepam. Yes, definitely. Again, I am repeating. Did you understand this? Yes, most of time you will think of lorazepam, because initially we try lorazepam, but it is written in the guidelines that if danger to life of patient or others, we give directly ECT. Clear? So have you understood this part? So I told you catatonic symptoms, motor symptoms of schizophrenia. Now let me summarize why. Yes, there are two ways to explain this concept. One, I discuss different classificatory system separately. Three symptom. Okay. Yes, One way, okay. What about resistance in the patient when bending like a wax candle? Okay, means okay, means resistance means you must have felt that if you bend a wax candle, there is this resistance. So the same resistance you will feel when you are doing passive movement. Okay. Second thing, IM. I have clearly written IM to don't get confused at different places that it is IV. No, we give IM. Okay, intramuscular. In delirium tremens, we give IV. Okay, we give IV because in delirium tremens we maintain cannula. I discussed cataplexy, dear. Okay, cataplexy is seen in narcolepsy, sudden loss of muscle tone. Okay, so one way is to describe it separately, another way is to merge. Initially, you will feel it a little bit difficult, but in long run, okay, I will give you answer of all your question. Okay, yes, in the last, because otherwise the flow will be interrupted. Okay, yes. So motor symptom or catatonic symptom, yes. So one type of schizophrenia is catatonic schizophrenia according to the old classification. Now these subtypes of schizophrenia are no longer accepted. Got the point? Now so one type of symptom are motor symptom. It may be present in schizophrenia. What are the latest classificatory system and diagnostic system? I will tell you, don't worry. Okay, now positive symptoms. In schizophrenia there may be positive symptoms. Yes, I will summarize it again for the time being. Yes, right here, positive symptoms of schizophrenia. Positive symptoms of schizophrenia. What are the positive symptoms of schizophrenia? Yes, positive symptoms means hallucination and delusion. Yes, you can understand like this, anything extra than normal person are positive symptoms. Yes, suppose you are the person, normal person, you don't become suspicious over other person without any reason, but schizophrenic patient may have delusion. Delusion is extra thing, so extra thing is positive symptom. Hallucination means we don't hear when there is no one around, who no one around is speaking, but schizophrenic patient may hear voices when there is no one around, so hallucination is positive symptom. So hallucination and delusion are positive symptom. We found that in brain, yes, we have two pathway. One is midbrain to limbic system, mesolimbic pathway, mesolimbic pathway. Suppose this is midbrain, this is midbrain. Suppose this is midbrain, midbrain to limbic system, mesolimbic pathway. Okay, there is one more pathway that is called mesocortical pathway, midbrain to cortex, midbrain to cortex, mesocortical pathway, midbrain to cortex, mesocortical pathway. Okay, mesolimbic pathway, mesocortical pathway. Okay, prefrontal cortex. So we found that mesolimbic pathway and mesocortical pathway both have dopamine. And we found that in mesolimbic pathway, if dopamine is increased, that produce positive symptom, increase positive symptoms. So how to remember? Question is asked, limbic L4 long, L4 लंबा यानी ज़्यादा, dopamine increase limbic pathway. So question is asked, mesolimbic pathway is from ventral tegmental area to nucleus accumbens. In midbrain ventral tegmental area, this limbic pathway nucleus accumbens. Nucleus, let me write here, ventral tegmental area to nucleus accumbens. Nucleus accumbens. So midbrain to or midbrain ventral tegmental area to nucleus accumbens, that is mesolimbic pathway. And in mesolimbic pathway, if limbic मतलब लंबा मतलब ज़्यादा, increase dopamine, that could produce positive symptoms. Those are hallucination and delusion. And I have already told you most common delusion are delusion of persecution. Most common hallucination are auditory hallucination. In schizophrenia, most common hallucination are auditory hallucination, not visual. Okay, visual hallucinations are usually found in delirium tremens. So visual hallucination give rise to suspicion of organicity. What I said, visual hallucination give rise to suspicion of organicity. If a patient comes to you in psychiatry OPD and you find that visual hallucinations are there, you will do all investigation to rule out brain pathology. Many times you will find brain pathology means organicity are there in visual hallucination. Got the point? If you don't remember, it's okay, just gave an idea. So positive symptom of schizophrenia are hallucination and delusion. So how questions are asked? Most common hallucination are auditory hallucination. Second question, yes, what is the reason of positive symptom? A question is asked, there is increased dopamine at which pathway, mesolimbic or mesocortical? Mesolimbic, L4 limbic. Okay, lamba, bada, increased dopamine, long. Okay, increased dopamine. Mesocortical pathway, mesocortical means midbrain ventral tegmental area to prefrontal cortex. Prefrontal cortex, decrease dopamine, produce negative symptoms. Decrease dopamine, negative symptom. In which pathway? Mesocortical pathway. I have given, yes, look at the screen. Mesocortical pathway from ventral tegmental area to prefrontal cortex. In this decreased dopamine, C4 come. Okay, or cut means decrease, cut, C4 cut, C4 decrease. Okay, decreased dopamine produce negative symptoms. There are so many hypotheses for the etiology of schizophrenia. Yes, one very commonly accepted hypothesis is increased dopamine at mesolimbic pathway produce positive symptom, at mesocortical pathway decreased dopamine produce negative symptoms. Clear? So till now in schizophrenia, I have told you that these 11 symptom, if out of 11 even a single symptom is there, you will say the patient is having schizophrenia. This topic ends. Now I started, yes, there may be multiple type of symptom in schizophrenia. One type of symptom is motor symptom or catatonic symptom, but now latest classification says that these symptoms may be present not only in schizophrenia, this may be present in other disorder which is separate diagnosis, that is catatonia itself, which may be present in mood disorder, which may be present in schizophrenia, which may present in hepatic encephalopathy, and in these, yes, you will say the diagnosis is catatonia. But even now, yes, ICD-10 says that in schizophrenia the symptoms may be catatonic symptoms, positive symptoms, negative symptoms, and disorganized symptoms. What I said? Disorganized symptom. Four types of symptoms are there. One is disorganized symptoms. It may be disorganized thought. If you remember disorganized thought, I told you formal thought disorder, derailment, loosening of association, neologism, loosening of association, derailment, incoherence, circumstantiality, tangentiality, thought block. All these are formal thought disorder. Yes, these are formal thought disorders. Clear? So formal thought disorder, I told you, are found in schizophrenia. So this is thought disorder. Behavior, abnormal behavior, you must have seen many times the schizophrenic patient doing abnormal behavior, picking things from the street. Yes. So again I repeat, catatonic symptom, positive symptom, disorganized symptom, negative symptom. What are negative symptom? Whenever you will find negative symptom, mostly they will start with alogia, decreased verbal communication. Means a patient of schizophrenia, yes, sometimes you will find a schizophrenia sitting alone, not communicating to anybody. Yes, decreased speech. He would talk to you only 5 words, 6 words, 10 words. That is sufficient. The whole day he would speak only 2 3 lines, nothing else. Okay, alogia. Anhedonia. Anhedonia means lack of pleasure in previously pleasurable activity. Previously he used to enjoy playing cricket. Suppose I am a person, I enjoy playing cricket. Now I don't enjoy playing cricket. So this is anhedonia, means lack of pleasure in previously pleasurable activity. Previously I used to enjoy playing cricket, but now I can't. Okay, yes. This anhedonia is considered both as negative symptom, and it may be present in depression also. Asociality, lack of social interaction. Apathy, lack of concern. Okay, you must have seen that we are social. Yes, like we connected with this telegram group, Facebook, and all different social media. But a schizophrenic patient would be asocial. Apathy, lack of concern, means he is not concerned with the result. Means exams are there, yes, he is least concerned with the exam. Apathy. Or he is least concerned with the emotions of other. Apathy. Okay. Avolition means, volition means motor activity. Means no motor activity, sitting at one place, no movement, very little movement. A motivation, you have motivation for doing hard work, but a schizophrenic patient may have no motivation. So negative symptoms you can now easily remember. Alogia means all are starting with A. Alogia, no language will speak only 2 3 words. Anhedonia, no, not getting pleasure. Asociality, would be not be social. So these are negative symptoms. So look at the screen. In DSM-5, I will remove some points only. Yes, yes, yes. I have discussed these points. Look at the screen carefully. I have discussed catatonic behavior. I have discussed negative symptoms. I have discussed formal thought disorder. I have discussed hallucination. I have discussed delusion. So these five things I have discussed in this way: catatonic symptoms, positive symptoms, formal thought disorder, negative symptoms. Okay, so these five I have described here. What is the purpose to describe it separately? Because in ICD-10 they have divided schizophrenia in four subtype. In fact, more than four, but questions are asked on these four subtype: catatonic schizophrenia, paranoid schizophrenia, hebephrenic schizophrenia, simple schizophrenia. So they ask question on these different types. So now you will remember very easily. Yes, I deliberately have put this like this. In paranoid schizophrenia, mainly positive symptom. Okay, I make this like this. Yes, I take different color. Paranoid schizophrenia, mainly with symptoms, positive symptoms. P4 paranoid, P4 positive. I take this color. Okay. So question is asked. Yes, they will ask question. Please do reply. They will ask question. There is a patient who was admitted in your ward. He was having suspiciousness over family member for 20 days. So for 2 months. He has auditory hallucination for 3 months. What is the diagnosis? Which type of schizophrenia it is? Please do reply. Which type of schizophrenia? A patient is there in the ward, he is having hallucination and illusion for 2 3 months. What is the diagnosis? Which type of schizophrenia? Paranoid schizophrenia. Paranoid means suspiciousness. Paranoid means suspiciousness. Okay, so this is the name of a schizophrenia. Paranoid schizophrenia. Good. Now, if a person is having formal thought disorder, mainly formal thought disorder, mainly formal thought disorder, mainly which types of disorder? Formal thought disorder, disorganized behavior. Yes, yes, good. Yes, formal thought disorder. A question is asked. Now listen carefully. If formal thought disorder, yes, now you understood what was the purpose to describe like this. Yes, so you will remember this. Formal thought disorder. Suppose a patient came to you. Yes, they will ask question like this. There is a patient admitted in the ward. He speak continuously and suddenly stops in the middle. And when he was asked, why are not you speaking, he don't reply anything. He pick up things from the street and put in mouth. He plays with his urine. He is abusing the family member and the staff of the hospital. The diagnosis is I am repeating, there is a person, there is a patient who speaks. Yes, he is telling something, stops in the middle. Stops in the middle. And when you ask him, why are not you stop speaking, speaking. Yes, he stops in the middle. Yes, don't explain why he's not speaking means he's not. Okay, good, Ujjwal. Not speaking, stops while speaking. Stops while speaking. Not tell the reason. This is thought block. Thought block. Yes, abnormal behavior. Behavior means pick things. Yes, good, Sunny. Thought block. And yes, abnormal behavior means picking things from the street. So abnormal behavior, formal thought disorder. Yes, the diagnosis would be hebephrenic schizophrenia. Okay. No, in this you will consider time period 1 month. I will discuss, don't worry. I will discuss, don't worry. You will not have this doubt. Yes, I know this is very confusing. Again I repeat, yes, in psychiatry it has become very difficult because we should take three classifications side by side, and many times students are confused. That's why I am giving in such a way that you will not be confused. I told you that this pattern is according to ICD-10. Okay, so ICD-10, the duration is 1 month. ICD-10 duration is 1 month. DSM-5 and ICD-11 has removed the subtypes. Has removed the subtypes. Now, yes, if a question is asked, yes, so write down. According to ICD-10, yes, to avoid confusion, ICD-10, according to ICD-10, less than 1 month. If symptoms are there less than 1 month, yes, then according to ICD-10, if symptom less than 1 month, then ATPD, acute transient psychotic disorder. I know it is going to disturb you and confuse you, but this is not my fault, because there are three classification and they have different points. But if these symptoms are more than 1 month, then schizophrenia. Okay, clear? So ICD-10, yes, if less than 1 month, these symptoms, ATPD, acute transient psychotic disorder. Another name of this is acute psychosis. Acute psychosis. Okay, but if more than 1 month, that is schizophrenia. So according to ICD-10, these symptoms should be present for how much duration? More than 1 month to make the diagnosis of schizophrenia. Clear? So you will write this. Okay, ATPD or acute psychosis. Less than 1 month, more than 1 month, schizophrenia. So this is. Now, if I ask you a question, yes, if a patient is having alogia, anhedonia, asociality, apathy, avolition, amotivation, all these symptoms are there for 2 months. Diagnosis is simple schizophrenia. Do you agree with this? Do you agree with this? No, I don't agree. Yes, in this you can't make, yes, just like I am doing like this. So the purpose to discuss in such a way is that you will remember that I have cut many times. Means in diagnosis of simple schizophrenia, the duration should be 1 year. Okay, I will discuss persistent delusional disorder. Okay. Yes, 1 year. Symptom should be 1 year. Good. There may be, you may be confused with depression. Yes, you may be confused with depression, but in simple schizophrenia, they will give one or more point, just like, yes, it's quite good if you interact with me like that, then it becomes a little bit more informative. When clinical questions are asked, they give negative symptoms, and we get confused many times that these negative symptoms may be part of depression, or they may be, the question means the patient may be having depression, but they will give few point, just like affective flattening. Affective flattening. Flattening of fact is seen in schizophrenia. So many times when they give clinical question on negative symptoms, they will give one or more points which will help you to differentiate the depression from simple schizophrenia. There is some disturbing noise, sorry for that, but I will, yes. So simple schizophrenia. So simple schizophrenia may be differentiated from depression by affective flattening. Okay, let me check it. If it is continued, then we'll have to search another option. But I was assured by the person. Yes, I am taking the class from my home, and I was assured by the person that today would not be any construction work. So I thought that I should take from my home only. But it's okay. It might be a little bit noisy intermittently. So yes. So did you understand this? So 2 points. One thing, 1 year. Second thing, yes, they will give at least few points which will suggest, yes, there are so many question in market in which, yes, but many time you will easily differentiate negative symptom from depression when they will give total, yes, avolition, apathy, asociality, alogia, then you can easily differentiate. But even if you can't differentiate, they will give you a point, just like affective flattening. Okay, now what was, yes, hierarchy system we can use, but you know that uh, in depression and yes, mood disorder and schizophrenia, the hierarchy is not so useful. That is totally dependent on clinical scenario. But for organic substance and other symptom, other disorder, hierarchy is more important. Okay, but don't worry, I have gone through all the questions. Always they give a particular hint. Yes, they can't ask you means randomly any confusing thing. Okay, if they ask, definitely, just like this year in NEET, they gave one question that was not a good question, and but they gave hint. Yes, you can say that affective flattening and means for clinical question. What I said, for clinical question they will give. Otherwise, this is not compulsion. Yes, emotions will be flat. Okay, so you may remember like this because I have gone through all the question. Whenever you will find these question, they will give hint to differentiate it from depression. Okay, one or two points they will give. Either they will add that negative symptoms are there and there is abnormal behavior also. What I said, abnormal behavior also. So this is not a strict rule that if negative symptom is there, only and only this would be there in patient. There may be some fluctuations in the symptoms, although diagnosis says yes. What I said, although diagnostic criteria said that yes, these symptoms should be only and only symptom for 1 year, and this was not absolute. Yes, this classification was not so practical. That's why ICD-11 and DSM-5 has removed this classification. Yes, even if flattening is there, to make the diagnosis of simple schizophrenia, the duration is 1 year. You can't skip 1 year. Okay, so now catatonia. Yes, the purpose to write in this way, on this side you will write best prognosis. On this side you will write worst prognosis. Okay, so simple schizophrenia worst prognosis, catatonic schizophrenia best prognosis, paranoid schizophrenia good prognosis, hebephrenic bad prognosis. So best, good, bad, worst. Okay, best, good, bad, worst prognosis. Clear? I think now we can take few questions, just like yes. Okay, IMIV, yes, cataplexy we have discussed. Okay, I think most of the question has been resolved. So till now, I think you have covered a lot of clinical questions about schizophrenia. And one thing again, I repeat, yes, what's the difference between persistent delusional disorder? I am going to discuss. Don't worry. For the time being, yes, I have discussed about ICD-10 criteria. Yes, if less than 1 month, ATPD, more than 1 month, schizophrenia. But DSM-5, what DSM-5 says? What DSM-5 says, let me tell. Yes, we already know these 5 symptoms: delusion, hallucination, formal thought disorder, negative symptom, catatonic symptom. According to DSM-5, if two or more than two symptoms, and out of these 2 symptoms, at least one symptom from these three. Yes, one symptom from these three. If you don't remember, one from this Okay, at least, and total one from these three, and total two or more than two. Okay, if you don't remember this one from these three, it's okay, but you will remember two or more than two symptoms. If these two or more than two symptoms are present less than 1 month, then it is brief psychotic disorder. If you remember, in ICD-10, what was the name? Please do reply. What was the name in ICD-10? Yes, ICD-10, the name was ATPD. ICD-10, the name was, let me write, in ICD-10, the name was ATPD, or acute, yes, acute psychosis. So you can say the same thing is having three name. The same thing is having three name: brief psychotic disorder, ATPD, and acute psychosis. What I said? Same thing is having three names. So in few questions you will find that two symptoms are there, and they will say 20 days. The hallucination and delusion are there for 20 days, and they will ask what is the diagnosis, and in one question you will find the diagnosis is brief psychotic disorder. In another question they will not give brief psychotic disorder in the option, they will give ATPD in the option. You will mark ATPD. In few question both brief and ATPD would not be in the option, they will give acute psychosis. You will mark acute psychosis. Okay, now if these two or more than two symptoms are present more than 6 months, then schizophrenia. So according to ICD-10, the duration of symptoms should be more than 1 month to make the diagnosis of schizophrenia. But in DSM-5, the duration of symptoms should be more than 6 months. More than 6 months to make the diagnosis of schizophrenia. Okay. But if symptoms are present from 1 month to 6 months, 1 month to 6 months, then it is schizophreniform disorder. Schizophreniform disorder. Okay. So questions are asked 1 to 6 month schizophreniform disorder. So I think it is clear now. The confusing point is that if they ask question, yes, I know that. Let me check in the break. I will check it, and if is there is any problem, continuous problem like this, so I will change the place. So don't worry. Just bear for 5-10 minutes more. Then I will ask them. Okay. Yes. So brief psychotic disorder, if less than 1 month, 1 to 6 month, schizophreniform disorder, more than 6 month, schizophrenia. Okay, but questions are asked in which you will be confused when they will give that a patient is having delusion and hallucination for 2 months, And now you will say, sir, we should follow ICD-10 or we should follow DSM-5. The simple rule is that if in option you find schizophreniform disorder, in question, in option, if you find the option schizophreniform disorder, means they are talking about DSM-5, because ICD-10 is not having this diagnosis. In ICD-10, schizophreniform disorder is not a diagnostic entity. Okay, clear? So this is ICD-10 and DSM-5. So now this question, now you know this question very easily solved. Yes, hierarchy system. Yes, again I repeat, a 67-year-old male brought to OPD, 1 year history of illness characterized by marked forgetfulness. Yes, hammering sound will definitely, actually there is some construction work on at the upper floor. I asked them, yes, about today, that is there any noisy work. They said no, there is no work today. And they assured me that's why I thought that I should take from the home. Yesterday the class was having little bit sound issue. I think other than this hammering, no other sound issue would be there, because I am having different type of mic at home. So yes, so this is the reason I took from the home. And in biochemistry also I took from the home, but now they start doing that, so I will check it in the break then. Okay, yes. In ICD-10, the symptom number of symptom again 2. Number of symptoms again 2. 2 or more than 2 symptoms, 2 or more than 2 symptoms. Then yes, same, 2 or more than 2 symptom out of these 5. Okay, but even ICD-10, out of these 11, even single symptom will make the diagnosis of schizophrenia. Clear? Now let me tell you one more thing. Yes, in this question, answer would be dementia. Answer would be dementia, because in this there is personality decline, poor self-care, progressive deterioration of memory, MMSC score 10. So hierarchy system, if patient is having diagnostic criteria for dementia and schizophrenia both, you will prefer organic mental disorder first. So in this you will prefer to mark answer as dementia. And if you remember, I told you visual hallucination itself tells about organicity. So there are so many points which are suggesting that the answer is dementia, because in schizophrenia most commonly hallucinations are auditory hallucinations. Clear? So I think I have tried to simplify. I know it seems little bit difficult initially, but trust me, you will remember a sequence: best prognosis, catatonia; worst prognosis, simple schizophrenia. There is a controversy about worst prognosis of heavy phrenic and simple. Few places you will find that heavy phrenic is having worst prognosis. No, worst prognosis, simple schizophrenia. Duration criteria 1 year. Okay, and many times to differentiate simple schizophrenia from depression, they give affective flattening. Okay, if less than 1 month, ATPD. 2 symptoms or more than 2 symptoms, less than 1 month, ATPD. More than 1 month, schizophrenia. Okay, in DSM-5, less than 1 month, brief psychotic disorder, but in ICD-10, ATPD, acute psychosis. Okay, 1 to 6 months, schizophreniform. In option if you find schizophrenia form is there in the option, you will follow DSM-5. This is a very important catching point. Sometimes we are confused, we should follow ICD-10 or DSM-5, then you will follow DSM-5 if you find one option is having schizophreniform disorder. Clear? So this is about schizophrenia. Now, yes, yes, few questions are being typed. So there is one more classification of schizophrenia, old classification, not used nowadays, but this is having historical importance and prognostic importance. A, a, a scientist came named T.J. Crow. Okay, again I repeat. Listen carefully. When they will ask question on subtype of schizophrenia, at that time they will give you confusing statement about the types of symptoms. Means if they want to ask which type of schizophrenia is this, they will give four option. Suppose catatonic, hebephrenic, paranoid, simple schizophrenia. Means if four options are there and they have given which type of schizophrenia is this, you need not to remember the fulfill the criteria. You will think only and only which are the predominant symptoms. Okay, when you will do the question, at that time you will appreciate why I have discussed like that. Again, I repeat, this classification of subtype has been removed. Subtype has been removed. Clear? Okay. So we can do one thing. We can take a short break of yes, formal thought. Yes, we can take a short break of 15 minutes. I know it is a little bit early, but I will ask the person that what about the issue of noise, and if it is continued, then I will shift to the uh, center. It would take 15 to 20 minutes to go to the center. Yes, it's near my house. Okay, so so we take a short break of 15 minutes.